I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to be talking about swimmer shoulder, what it is, how to diagnose it, how to treat it. So before we begin, I know this is prime time swim season. This is really cropping up a lot. And having kids of my own, I know you can't run to the doctor with every little ache and pain that they tell you about. You would never leave. You got to figure out what you have to take seriously, what you don't. I always say 2 weeks. 2 weeks of them saying, my shoulder hurts, especially if they're a swimmer or any overhead athlete for that matter. That's not going away on its own. You have to really start to pay attention to that. And the longer you ignore it, the longer you put them at risk of it developing into something very serious, and the longer it's going to take to actually rehab. Most of what happens with swimmer's shoulder can be done and treated at home or with a good dry land program. But if you don't address it and you ignore it and you just put ice on it, it's going to be fine. It's not going to be fine. You cannot do the continuous yardage that swimmers do and be able to sustain that if you have a shoulder problem or if your shoulder hurts. Yes, one night maybe you tweaked it, maybe you did too hard a dry land, maybe something happened and it does bother you one night. So you put some ice on it and it goes away by the next day. That's not a problem. That's not what I'm talking about. I'm talking about the athletes that we see, and being a swim coach myself, we see athletes out every single night continuously. My shoulder hurts, my shoulder hurts. Now, again, what do we do with those that we, are questioning whether their shoulder really hurts? At some point you have to believe them. When they are constantly out, you have to kind of give them the benefit of the doubt if they're sitting out of practice every night complaining of shoulder issues. There's some problems going on. So pay attention when your swimmer is telling you there is a shoulder problem. Anything that goes on longer than 2 weeks, you're compromising more than just their shoulder. You're going to bring neck issues into it. You're going to wind up, I know that most parents right now especially don't want to take their kids out of swim season because it is in the prime time. We're getting into some really heavy meets. But the issue is the longer you ignore it, the chances are that you will not be able to swim. Your child will be pulled out. So you really need to pay attention to any shoulder pain. So what is swimmer's shoulder? Basically, it's that generic term that's kind of catch-all for shoulder pain. For swimmer's shoulder, you can feel the pain down in here. You can feel it up in here. You can feel it sometimes in here. Generally not so much in the back unless you've let it go on for too long, and then it's coming up into the neck and you're going to wind up having more issues. The more you feel the pain all around the shoulder, the longer you've ignored it. So it's really hard to swim with pain in your shoulder. So this can come on pretty rapidly, and it is something that you do need to pay attention to, because when you're swimming 1,000, 2,000, 3,000, 10,000 yards a day or even a practice and doing it multiple times in a week, that adds up on the shoulder, and that overhead motion, and I'm going to go through kind of what causes some of the shoulder pain, is really aggravating. So you need to be aware, and you need to kind of take a step back and say, okay, maybe we need to get this treated. It is not something to be ignored. I know we're all running in a million directions, but if your kid is serious about swimming and you wind up with a kid that has a sore shoulder or shoulder pain, you don't want to ignore it. You do want to make sure that depending on what level your child is swimming at, so if they're not a 5-day-a-week swimmer, then great. And if they're in multi-sports at one time, I have a swimmer, she does swimming, she does gymnastics, I'm not sure how many other sports she does at once, but she's 8, so she can do whatever she wants. We don't focus on one sport. But I also have a 12-year-old who does focus more on swimming. So that's a 5-day-a-week sport. Your swimmer needs to be doing a solid dry land program. There is exercises on our YouTube channel that you can go and reference. It's called the Swimmer 7, that will actually take you through a good dry land program for swimming. You are not sacrificing time out of the water if you actually incorporate a dry land program. You will be a better swimmer. The stronger you make your shoulders, the stronger you make your legs outside of rotation overhead happens in swimming, especially flyers, backstrokers, freestylers. You're just constantly overhead. Having that dry land program in place, making sure you're doing it 2 to 3 times a week is significant. So really make sure that If you have that more serious swimmer, that they are doing a dry land component. It doesn't have to be more than 30 minutes to 45 minutes, all body weight. You know, really you should not be loading anything until you're a pretty experienced dry land athlete, and that should be discussed with a performance coach. Then you can add weight or load your spine, but until then, everything should be body weight. There's really no need, especially starting out, to have that load. So just make sure that you have that in place also. It is extremely important. Recovery, you know, all these things that you hear about are not just buzzwords. Dry land recovery, you know, your yardage, it's just as important as getting into the pool and swimming. So what is swimmer's shoulder? So what happens when you swim, and whether you're swimming freestyle, whatever you're doing overhead, you wind up with this rotation. So you have a lot of moving parts in your shoulder. You have a lot of muscles. What happens is when you don't have a good dry land program, which most swimmers do not, this pec area winds up being really strong because everything you're doing is here. Everything you're doing is up here. Everything you're doing is more front concentrated. Plus, you wind up sitting like this, so everything up is driving forward. So you wind up like this. Is why everyone kind of, you know, says shoulders are, swimmers have these rounded shoulders, because we do when we walk like this. But that means a lot of this back here is extremely weak. That's your rotator cuff. You cannot have a good strong stroke without a rotator cuff being extremely strong. So, and if you don't work out your rotator cuff, it's not going to be strong on its own. So one of the things we're going to kind of go through is our rotator cuff strengthening exercises. But before we get to that, if this isn't strong enough to stabilize, what's going to happen is you're going to have this muscle that's going to move up into this bone here. So, I'm sorry, this bone move up into this bone. And it's going to start pinching some of these muscles. So you're going to wind up with a pinching feeling. If any of you are swimmers or any of your children describe a pinching feeling when they're coming overhead and they're swimming, whether it's butterfly, whether it's backstroke, not so much in breaststroke, but it does happen, they're winding up with what we call impingement. They're actually pinching a muscle. This pinching of the muscle can lead to a rotator cuff tear, it can lead to inflammation, and the dreaded tendonitis. So that pinching feeling, if they're just like, oh, it's like right here, that's the beginning of a lot of problems. And if we catch it early enough, it's going to be quickly resolved, and we can take care of it. And if you do have a swimmer that's telling you that they have pinching when they come overhead, you need to get them in to see a qualified physical therapist. We'll offer a free consultation. All you have to do is call our office at 215-997-9898. But getting back to that pinching feeling is kind of the precursor to everything. Then what happens is you're going to start to feel this pain sort of in here. Now you may or may not have felt a pinching feeling, and when you're swimming and you're swimming a lot of yards and you're swimming a lot of hard yards, you're going to alternate your stroke, or you're going to, you're going to vary your stroke. So instead of having nice high elbows, the first thing you're going to see is start to drop, okay? And if you're a swimmer and you're an adult swimmer, you're going to start to drop your elbows. Why? Because the higher your elbows, the more that possibility of that bone pinching that muscle is going to be. So you're going to start dropping your elbows. You're going to start rotating more, whether it's this way or that way. You're going to start using your head a lot more. You're going to start compensating, and your swimming is going to suffer because you're going to allow the shoulder to not feel as much pain. Well, it is different for everybody on how those variations show up, but they show up. So you really have to have a keen eye to figure it out. But the longer you let this go on, the strokes are going to suffer. It's not going to be a clean, crisp stroke anymore because all you're going to want to do is stop this shoulder pain. So most of the time, this shoulder pain is coming from some sort of inflammation in through here. Now, how far that inflammation has developed depends on how long you've let the shoulder pain go on. Could be tendonitis, could be an absolute tear, could be part of your labrum, which is a little cartilage in here, wearing away. All of that is because when you start to feel pain, you're going to start to change how you swim. If your swimmer's getting headaches, they're starting to do this, okay, with their shoulder, helping to get that shoulder up out of the water, using inappropriate muscles because these are tired and these are sore. So pay attention when they say their shoulder hurts because it is a downward spiral from there. And the sooner you get to it, the sooner we can stop it, the sooner it's going to get fixed and you're not going to miss any time out of the water. Whereas if this develops into a tendonitis, some swimmers never recover. So it's really important. The shoulders for swimming are so important. You really need to be careful with them. So I'm going to show you just a couple quick exercises you can do. So let's say this is your first week and you're really starting to feel shoulder pain and you want to do a couple exercises on dry land to kind of help you. So the first thing you're going to want to do is you're just going to find a table and you're going to want to punch the table, okay? It's not a big movement, okay? And it's not this. So my arm is straight and I'm just pushing down, okay? If you're super advanced, you can actually sit on the table and lift your butt off the table and hold that, okay? So this is like the beginner move, okay? And this is the more advanced move. And what you're going to do with that is you're strengthening some of the muscles that are going to help pull your shoulder down. So you're not going to be doing this compression anymore, okay? So that's one of the first exercises you can do. The next one is just a rotator cuff exercise. So what you can do is you can start by having your arm against the door and pushing against the door. Hold that for 5 seconds. Do 30 of those. You're probably going to feel fatigued with that. Okay, just the resisted out motion. Just this motion, okay? And all you're going to do is just hold that. Now, again, if that gets too easy, you can start to lay on your side, take a soup can, and rotate your arm out. One of the things that you don't want to do is, I see swimmers do this all the time, is stretch like this. That's stretching the posterior capsule of the shoulder. There's no need for it. It's not going to do anything. If you're going to stretch something, stretch the front of your chest, because we're constantly like this. So if you find a doorway and you can prop your arms up in it and then take a step forward and lean forward so your chest is being stretched and you're going to feel stretch across here, that's advantageous. But this, which I see all swimmers do, and I don't know why, because the back of you, especially that capsule, is completely stretched out. So if your shoulder hurts and you're doing this, you're not doing yourself any good. It is not helping anything. It might feel good just because you're holding your arm and you're cradling it, but you're not actually stretching anything you need to stretch. In fact, you're probably stretching something that doesn't need to be stretched. So really important, this very popular swimmer move, not something that should be done, especially if you're dealing with shoulder pain, because you want to tighten that capsule up. You want to tighten the muscles around that up, so that way it'll help hold that shoulder into place a little bit better. So those are just a couple of exercises, a little bit of explanation on what swimmer shoulder is, and some things you can do immediately when you feel it. You want to ice it every night. If you feel it, get the inflammation calmed down, start icing it, especially after practice, 15 minutes to help some of that inflammation. If you are experiencing shoulder pain and you want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to help you. Thanks and have a good night.